This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
Social interaction and play is an essential part of a child's development. At this stage, they also develop communication and cognitive skills. But there are instances that a child does not interact well with others due to a condition called pervasive developmental disorder. The pervasive developmental disorder refers to delays in many basic skills like the ability to socialize with others, to communicate, and to use imagination. A familiar type of pervasive developmental disorder is autism. According to a study from the Centers for Disease Control and Prevention, 1 in every 88 children worldwide have been identified with autism spectrum disorder. In the Philippines, there are more than 922,000 Filipinos diagnosed with autism, as reported by the Autism Society of the Philippines, with no known cause or cure.
Autism is tinatawag na pervasive childhood disorder. Pervasive siya. Unang-una, it appears early in childhood. So usually the child does not speak, parang hindi kanya nadidinig. He doesn't have eye contact, and sometimes may cognitive impairments sa thinking niya, at saka usually the repetitive behavior, parang ginaganon yung kamay. It's a lifelong disorder.
Just like the case of Patricia, the only daughter of Rajinish and Luan Dulay.
She was about 1 year and a half. Because before that, she was very, hindi naman very bibo, pero she has tricks like she can wave, and she can close open, and she can dance. Pero parang biglang naging quiet siya, and we noticed na parang wala pa siyang language at that time. We noticed na pag excited siya, nagpa-flap siya ng hands niya, ganyan. Tapos, medyo not really sobrang tantrums, pero parang iyak siya lagi. She was not responding to her name anymore. So that's what made us parang consult a dev bed.
But since her diagnosis, Patricia is undergoing occupational speech and movement therapy.
Very good.
How can early detection be done? Where does one seek help when parents have a child that has been diagnosed with autism? These and more tonight on MedTalk.
April is Autism Month, and tonight we will talk about this condition and how our society responds to the needs of the individuals diagnosed with autism. Joining us is Dr. Francis De Malanta, Section Chief of the Developmental and Behavioral Pediatrics at the St. Luke's Medical Center, Global City and Quezon City. Also with us is Mr. Anthony Grecia, an occupational therapist and president of the Occupational Therapy Association of the Philippines and program director of GOALS. You can participate in our discussion by calling our hotline. You can also follow us on Twitter, post on our Facebook page, or send us an email. Good evening, Dr. De Malanta. Teacher Anthony, welcome to the show.
Good evening, Angel.
So April has been designated as Autism Month.
Yes.
I'd like to know more about this, so please help us understand the phenomenon called autism.
Okay, autism is actually a neurological disorder. So it's not a disease, so you don't get HAWA from it, but actually brain-based and presents with a triad of symptoms of speech delay, social unrelatedness, and stereotypical movement, as what Dr. Karandang mentioned, the repetitive movement of either hands or a child going around in circles.
So upon mentioning the triad, let's talk about it briefly, each one of them, Dr. Dimaran.
Okay, so speech delay, we know that a child presents with speech delay if at 2 years old they don't have about 50 words. And that's excluding mama, papa, lolo, lola, ama, angkong, yaya. Okay, because sometimes that's how the parents will count the words, right? And it's already a fallacy to think that the boys will speak much later than the girls. So our appeal probably to the parents out there is that when they have a concern about their children, it's best to raise it up with your pediatrician so that you can be properly referred. Now, the stereotypical movement would be the repetitive movements that a child does, and that's something pervasive. So, paulit-ulit. It could be manifested as hand flapping, like doing this with your arms, like what we saw earlier. And the social unrelatedness would be a child who would have a world of his own, preferring to play alone rather than playing with another sibling or friends or cousins. Or like when you go to a store and they wouldn't play with the other kids in the playground or a party. So they would be playing on their own, would not have a pretend play like feeding the bottle to a doll or playing with his toys properly. So there's inappropriate play.
Okay, so you mentioned also, Doctor, about the speech.
Yes.
That's where Teacher Anthony comes in, speech therapy.
Usually we work with a speech therapist, but as an occupational therapist, we work more in terms of managing and preparing the behaviors of the child so that they can interact with people, so that they focus and they're much ready more for speech therapy. So usually the occupational therapists are the first liners to manage the behaviors of these children.
Because we need to, we need to manage the behavior before we are able to fix the speech. So again, like you mentioned earlier, that you mentioned that they would be going to speech therapist. In fact, they should first see an occupational therapist if the behavior is maladaptive, so that it'll be easier for the speech therapist to work on the language skills.
Because other people might think that because that is the means of communication, it's a speech problem.
Yes.
Instead of going to an occupational therapist for speech therapy.
Yes, it's easy to detect the speech problem, but usually it starts with, what are the prerequisites for speech? First, there has to be social awareness. They're aware of people. Now, sometimes they're not aware of other people because they have a different way of receiving the information from the environment, the senses. They have a different way. So
why is that? Why do they have a different way?
Because one way of perceiving and understanding children with autism is they have a different way of sensory processing. There are certain things that we hear easily, but for them it could be too much, or for them it's too soft.
So there are children who would cover their ears when they hear your hair dryer, your mixer, vacuum cleaner. Okay, they wouldn't, these are the sensory processing problems which will appear early, and sometimes children don't want to be touched or would love to touch a certain part of the body or certain textures. Some will smell their food before eating. Some will be picky eaters. So it has to do with the sensibilities.
That's the behavioral pattern that is
Those are the sensory integration problems which the occupational therapist will address.
And because they have a very specific kind of sensory processing problem, this limits now their ability to interact and play. So for example, if the toy is producing too much sound, they won't play with that. They'd prefer with a specific toy now. That kind of reaches their level. So they'll be fixated now with this toy. So limited toys already. Or if other children keeps on touching them, they don't like it. So the occupational therapist now would target the senses for them to eventually accept the stimulation from the environment for them to focus. And focusing and social awareness is needed before you train the speech. Okay, so
at what age do these symptoms manifest?
We are able to diagnose them as early as 18 months. And again, at 2 years old, where we need to see children being able to have an appropriate play, being able to point. One thing is that many of the autistic children are not able to point. when you say, where's the light? And some parents will say, yeah, they'll point, but they'll use their 5 fingers. Okay, so they need to point with 1 finger. They have to have joint attention. When you say, let's look at the car, and they're supposed to look there, but they will not be engaging with another person. So again, what we need is early recognition so that there's early intervention and better prognosis for the children with this disorder.
So at 18 months, what can a child do already? What is he supposed to do at that age?
There are different things across the different domains of development, which would cover your motor skills, your gross motor skills for your big muscle groups, your fine motor skills, and your language, which may be divided into expressive and receptive language, and your personal adaptive skills. From that point, there's a certain window, like from 18 to 24 months. A child by then should be able to run by that time, walking, running. And if they're not doing that, we need also to intervene. Maybe what I like to say is that during the first year of life, we watch out for physical or the motor skills. A child is supposed to be able to roll over before they can sit, before they can crawl, stand, and walk and run. So they have to follow a certain pattern of development. And in terms of language, they're supposed to be able to understand and then be able to talk in a manner that goes from cooing, babbling, your baba, mama, dada, okay, until they say their first words and they form
sentence.
2-word phrases and all.
One of the things that we see in the development, because usually at 18 to 24 months, that's the time that the child shifts from solitary play to parallel play. Solitary play is that they play alone, solitary. And then parallel play, they start to play, they play with what other children play. They start to mind other children, and they start to be socially aware with other children. This is now where sometimes children with autism have problems because they lack social awareness. They tend to just play alone. They stick to solitary play. So it's one of the things that they show in terms of, as Dr. Dimalanta pointed out, there's a problem in social interaction. So we look at the play. How do they interact in terms of play? So this is the time.
Another thing also has to do with their eye contact. A child is supposed to be able to establish that eye contact early on, even in the first 6 months of life. And sometimes you can mistake that a child is too good and too nice and not fussy at all, and you think that it's a nice thing, when in fact you should be engaging in terms of smiling back at you and all. And we have many children who present this way and cannot smile as much as
they're not responding to the parent when the parent asks them to smile, or like you mentioned earlier, to point to the light, the moon, the stars.
And in terms of words, some of them may repeat something that a parent will say, which would point to an echolalia, repeating the words that's been said. What's your name? So instead of answering it, they would say, what's your name? Okay, and
or
these are some red flag signs, or another word.
An understandable, what we call jargon.
And not connected to the question that you asked. So they can have this jargoning, which could be incoherent, okay, and they'll say something out of the blues.
And that's a cause also for
these are red flag, red flag
for
signs for the parents to seek consult.
We'll talk more about the red flag signs, but first we'll go to our Facebook questions. Dr. Teacher Anthony. Our Facebook question is, can gene testing of couples before fertilization reduce cases of autism in their offspring?
We don't have enough clinical evidence which would point out to this. Autism is not tested through our newborn screening, nor is there any blood test that will show you that your child, or you may be predisposed the same way they would do an amniocentesis for a child with Down syndrome. So autism has no specific test yet. There may be genes that they already identified but are not totally conclusive about causing autism.
Another question from Facebook. Can a child diagnosed with autism attend a regular school?
Definitely, right? Okay. Depending on the severity.
Yes, siguro we'd like to point out that autism is a spectrum. So there are those in the mild, moderate, and there are those in the severe. Most of those in the mild can attend can attend regular school. Those in the moderate, those who are showing moderate symptoms of autism can still attend regular school with some support. It would be more difficult for those in the lower end of the spectrum.
What is challenging here is that no two children present the same way. So like Teacher Anthony has mentioned, it goes through a spectrum from the low functioning to the high functioning. So we can have extremely smart autistic children who grow up into adults that we refer to as Asperger's syndrome, who didn't have any speech delay but have social relationship problems. Yeah. So maybe these are the children or the adults or the classmates we had who were in the top of the class but didn't have enough social skills. So they can function, they can memorize, they have photographic memories, they can do things. There are some architects who draw very well, who sing, who can remember notes, okay, but are lacking in social skills. So this is the thing that we have to address with them.
One of my remarkable students is actually gonna graduate this October from one of the main universities.
Wow! Yes. Okay. Congratulations!
And then it's very fun. But this boy, he has problems with interaction. But when you ask him about parts of the cell, he would know it.
He would know everything.
Yes, yes.
So there's one aspect of their life that is lacking, and we'll talk more about this. We'll see if it's permanent or they can outgrow it. When MedTalk returns, still talking about autism.
Did you know that one of the greatest scientists of all time, Albert Einstein, suffered from a type of autism called Asperger's syndrome? This is according to the researchers at the Cambridge University and the Oxford University. Einstein developed the theory of relativity, but according to research, he was a loner and also a confusing lecturer.
We're back on MedTalk. Joining us in the discussion is Ranil Sorongon, Executive Director of the Autism Society Philippines. Hi Ranil, welcome.
Yeah, thank you for inviting us.
Pleasure is ours.
Thank you, Solar Station.
Salamat. Ranil, what kind of support does the Autism Society Philippines give families who have children that have been diagnosed with autism?
Yeah. Basically, Autism Society Philippines is a parent support organization. So we usually give support to parents and families whose child has been diagnosed with autism. So we have support group sessions, we have regular monthly seminars for parents, for professionals, for caregivers, and we also give support to siblings of persons with autism.
What kind of support is extended? Like an example of the kind of support that the society gives?
Like for example, if they found out that there are symptoms manifesting with their children, so usually they will call the office and they will ask us. That's why I'm bringing the directory of resources for persons with autism in the Philippines. So if ever, we give them referral. So we have here the list of developmental pediatrician, like Doc Francis, and we also have here the list of the therapy centers, like the Center of Teacher Anthony, goals and private schools, public schools, accepting children with autism, and also the different chapters of Autism Society Philippines. As of now, we have 63 chapters all over the Philippines, and more or less we have 10,000 members.
I think what's more important that the Autism Society of the Philippines does is that they offer maybe a group for a group to come together so they can share experiences, what works best for one or the other. And as Mr. Ranil has mentioned, there's sibling programs because sometimes the child that's left not being cared for would be the child without autism. In a family of, let's say, you have 2 children or 3, there's too much emphasis now on the child that you want to get well that we sometimes forget the sibling. So that's what their support group
Dr.
offers.
Francis is very correct. Actually, just last Saturday, we have our monthly family support group meeting in the office. So parents of children with autism, they went to the office, exchange their experiences, share the experiences, and give support to each other. And Dr. Francis again mentioned a while ago that we have sibling support group. In fact, my wife, you met at the lobby, she's the one facilitating we call it here in the Philippines, SIBS camp.
It's very important because for the other members of the family to understand what's going on with the child or the patient diagnosed with autism.
And to be part of this treatment program, because the critical unit is the family, where it all starts with the parents accepting the condition, that there's something that can be done, because the key again here is acceptance. Many will obviously be in denial and will hurt, and every dream they may have had for this child may seem to disappear, but with the support group that they offer, they share common experiences, then the intervention comes in and progress becomes more hopeful.
They get support from the Autism Society of the Philippines, and then also I'd like to commend the society in terms of really collaborating with the different professionals. So most of their workshops, they get together all the families, and then a professional would train the parents. Like in that way, they could carry out some of the programs at home. So,
which is very important because, like for example, they go to an occupational therapist, they go to a doctor, and they go to the society. But when they get home, what do they do at home that they have learned from all these different arms of society? How do you put it together? So how does a parent or the other siblings in the family put it together?
So understanding them and understanding the needs also of the child, because sometimes there's preferential treatment for the child with special needs. That's why they say the other children will feel left out, okay, and or the other children will be given a bigger responsibility. You take care of this.
Watch your brother or watch
like,
your sister.
Pagbigyan mo kasi hindi ka naiintindihan, and it does not work well in terms of family dynamics because you're not enabling the child with special needs to be independent. Because our goal here is empowering families, okay, and trying to make them move forward to reach the fullest potential of a child up to where he can really go.
Tama si Dr. Francis kasi sa mga karanasan ng Autism Society Philippines, sinasabi nila, bakit parati na lang yung mga kapatid ko na may autismo? Bakit ako ba na kapatid, hindi ba ako special? Bakit sila lang parati? That's why we had this group, we had this siblings camp also to give support to siblings of persons with autism kasi lahat naman sila ay espesyal.
At saka dapat lahat equal treatment.
Tama.
And they feel, you'll even be surprised to find out that the siblings feel envious that this child goes to a lot of places which they don't go to, not knowing or realizing that it's because they need to help that sibling.
So we'll get to know more about that. We'll also get to know more about autism and how we can understand them better as individuals. We'll go to our Facebook question first. Gentlemen, can autism be outgrown? So if it's diagnosed early on, maybe as the child or the patient diagnosed with autism grows up, can this be outgrown?
Sadly, it's a lifelong disorder, not a disease that needs to be treated, but if it goes, being lifelong, you're able to reach certain levels of functioning. So what's more important is for you to find out, or for you to be able to push this child to reach their fullest potential.
So it can't be outgrown. Is it curable?
Again, since it's not a disease, you can't cure it, but we've seen over the years that it has evolved. You mentioned earlier that it's 1 out of 88, and sadly, that statistics has grown to 1:55 in the past months.
Why
a
has
worldwide
it grown?
epidemic. It has been dubbed as an epidemic already by the disease control in the US. Okay, and we don't know what's causing it. That's why it's more difficult to treat. There are hypothesis into maybe something in our environment, something that we're eating, we don't know what it is, but exponentially all over the world, maybe because of better recognition or of finding out these kids earlier, which may explain
although it
rise.
can't be outgrown, no, much of the problems can be managed. So in fact, before, a lot of children with autism have also problems in terms of learning or intelligence, but right now, because of the development of how we interact with them, more and more in regular schools. So the problem, although it's lifelong, the problems can be managed, and that's to give hope to the family that later on it's like they could finish school, some of them could finish school, some of them could still play, some of them could develop close friendships as long as they're being intervened. Okay, it can be managed. Yes, it cannot be outgrown, but it can be managed.
Which is good. And again, the word that we always use tonight is hope.
Yes.
There is hope that it can be managed. There's a support group that can help the families of children diagnosed with autism. We go back to our discussion. I thought there was a Facebook. We'll go back to our Facebook and Twitter questions. But I'd also like to know, is it only developmental? We talk about the developmental delay, or is it something permanent? Because you say that they develop other social and communication skills as they age. So is it permanent? Will there be a change as they grow up with the help of Teacher Anthony and these groups?
With the proper intervention, definitely there will be change. Some, through intervention, will improve, like very fast.
What kind of improvement?
In terms of socialization, in terms of being able to speak, in terms of play, okay? However, some will take slower but will plateau, okay? Again, so it's different for each child. Like we mentioned earlier, it's very challenging because no two children will present the same way. So even in families, you'll have a child who's not speaking and would be having behavioral outbursts like head banging and biting themselves, hitting others, having self-injurious behavior. So that needs a whole lot more of time from the therapist to fix the behavior. So what we try to do as a team, and it's important here to work together, because not
with
one
parent.
person, especially with the parent as a critical factor here. Many of the parents might just want to go to a therapy center, leave their child, and get them back okay. But the thing is, we need to empower families, teach them how to respond to the different behavior of the child.
So that when they get home, they will continue what they have learned from
Yes,
the
because
teacher,
sometimes
from the
many of the
doctor,
children will be behaved in the therapy center, but at home will continue to do what they want to do, because we have here lolas and yayas and lolas allowing them to do the things that they want to do. So there are no limits that are set, so the child gets confused. They will respond to an authority figure like Teacher Anthony.
Only because they remember.
Yes.
But one of the key is that they can observe the sessions. At times, there are therapy centers that that we train the parent. Like, okay, in the first few sessions, it's us. Later on, we ask the caregiver or the family member to also do some of the activities so that the child gets to generalize the skill, even though they're at home already.
So they can transition.
Angel, there are some centers, some special education centers, some therapy centers, also offering home management program.
Oh, okay.
Yeah, it's in the home setting.
Okay, so if they sometimes they have no resources to go to a center or to go to a doctor, to go to a teacher, but there is help that can be extended in the home without having to go to these different
One time we have a collaboration with Teacher Anthony, so we have this libreng therapy.
Merong libreng therapy.
We assess.
Therapy.
Therapy.
Okay, that's
we collaborate, and then the therapy is a program naman initiated by UP Manila and some centers.
Okay.
Then we give free therapy.
Okay, that's very nice to know. And thank you very much for helping us understand and helping us learn more about patients diagnosed with autism that give hope to the families and to the patient as well. Thank you very much.
Thank you very much.
Thank you. I'd like to thank our guests for gracing our show tonight and helping us understand more about autism. Once again, thank you to Dr. Francis Di Malanta, Mr. Anthony Grescia, and Mr. Ranil Sorongon. See you again next Tuesday on MedTalk as we talk about hygiene. 10 p.m. on your scheduled on-air consultation on the Solar News Channel. This is Angel Jacob. Good night.
Social interaction and play is an essential part of a child's development. At this stage, they also develop communication and cognitive skills. But there are instances that a child does not interact well with others due to a condition called pervasive developmental disorder. The Society of the Philippines with no known cause or cure.
Autism is tinatawag na pervasive childhood disorder. Pervasive siya. Unang-una, it appears early in childhood. So usually the child does not speak, parang hindi kanya nadidinig, it doesn't have eye contact, and sometimes may cognitive impairment sa thinking niya, at saka usually the repetitive behavior niya, parang ginaganon yung kamay. It's a lifelong disorder.
Just like the case of Patricia, the only daughter of Rajinish and Luan Dulay.
She was about 1 year and a half. Because before that, she was very, hindi naman very bibo, pero she has tricks like she can wave, and she can close open, and she can dance. Pero parang biglang naging quiet siya, and we noticed na parang wala pa siyang language at that time. We noticed na pag excited siya, nagpa-flap siya ng hands niya, ganyan. Tapos, medyo, not really sobrang tantrums, pero
This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
Pervasive developmental disorder refers to delays in many basic skills like the ability to socialize with others, to communicate, and to use imagination. A familiar type of pervasive developmental disorder is autism. According to a study from the Centers for Disease Control and Prevention, 1 in every 88 children worldwide have been identified with autism spectrum disorder. In the Philippines, there are more than 922,000 Filipinos diagnosed with autism, as reported by the Autism